Welcome to the MamasteFit YouTube channel. In this workout, we're going to be strengthening the core musculature in addition to the lower body, the upper body. So we've got a lot going on to help you feel strong as you navigate motherhood. This workout is part C of workout number 5 from our postpartum fitness programs. We have both an on-demand program, which are full-length workout videos like this, where you follow and work out with at the same time. And then we also have our app-based program, which is going to be self-paced workouts, which is a list of exercise with short demo videos, so you can work out at your own pace. You can check out all of our postpartum fitness programs on our website at mamastefit.com/fitness-programs, and we'll link them down below. And you can use code YouTube10 to get 10% off any of our online offerings. For this workout, we're going to be moving through 4 different exercises, and it's going to be 3 rounds, about 30 seconds each. So the first exercise is going to be a box squat row, and so we're going to have 2 different variations of this. The first is going to be a banded variation, and then I'll show you one without an attachment point. So with the box squat row, you're going to have your elevated surface that you're going to be squatting down to, and then you'll hold onto your band that's anywhere from like knee to chest level. We're going to inhale to lower to the box as you reach forward with the band, keeping weight in your feet, and then exhale to row that band as you extend in the hip. So inhales to reach, exhales to row. If you don't have an attachment point or you don't want to attach your band to anything, you just hold your long resistance band out in front of you. We're going to inhale to lower as you reach forward, and then exhale, anchor with one hand as you row back. Inhale, reach forward, exhale to row as you extend. The second exercise will be a wall-supported RDL. So you'll have your 2 weights, and you're going to take one foot and put it into the wall behind you so that the knees are fairly aligned to one another. So you may need to adjust your stance. We're going to inhale to lower down, keeping tension in the upper body, and then exhale to stand up. And so I'm keeping most of the weight in that front leg, but you're using that back foot to give you a little bit of support, feeling a big stretch through that hamstring and glute of the standing leg, holding on to your 2 weights, but you can also just do this body weight as well. The third exercise is going to be a half kneeling Pallof press with rotation. So with the attachment variation, you'll attach a band around knee to hip level, and you're going to bring that band to the center of your chest with the outside leg forward. You'll press that band out and then exhale to rotate away. Inhale to come out, and then bring the band back to your chest. In the no attachment variation, you'll come in a half kneeling position, and the opposite hand is going to reach out to your side, and that same side hand is going to be in your chest. You'll press that band forward and then rotate away, keeping that anchor point there. Come back, and then bring the band back in. So keep that anchor point out, press out, and then rotate away. For the last exercise, we're going to move down to the floor, and we're going to come into a bridge position. You can either come up onto your heels, or you can keep the feet flat. The opposite hand and knee are going to reach across to press into each other, keeping those hips lifted. Lower back down, and then we'll switch to do the opposite side. For this workout, we're going to need a band attached around knee to chest level. You can either do the attachment point, or you can just hold on to a long resistance band. We'll also need an elevated surface to squat down to for the box squat. You'll also need 2 light to medium weights for the wall-supported RDLs, and then you'll also need 1 to 2 light weights for the RDLs. Once you've got your equipment, let's go ahead and get started with round number 1 of today's workout. So we'll start round number 1 with that box squat. So grabbing on to your long band, either one without or with the attachment point, and you'll come to your elevated surface that you're going to squat down to. So we're going to inhale to reach forward as we lower, and then exhale to come on up. So inhale, reach forward, squat down to your box. Keep weight in the feet so we're not sitting back onto the box. And then exhale, extend in the feet as you row. Inhale, reach forward. Exhale to extend. So we're keeping weight in the feet the entire time. And as you relearn to lift in the postpartum, using supported variations like the box squat or the wall-supported RDL can help you relearn the movement patterns. Let's go ahead and switch hands. Inhale, reach forward. Exhale to row as you extend, keeping weight in the feet. So the box is giving me that stopping point. It's helping to decrease the range of motion, and then also just to give me a little bit of support at the bottom. Go ahead and release that band, and let's move on to the wall supported RDLs. So grabbing on to your weight. If you want, you can place a yoga block between the thighs as well. You're going to put one foot into the wall, and the knees are going to be aligned to one another. Inhale, reach forward as you push the hips towards the wall. Exhale, stand up. Inhale, lower down. Exhale, come on up. So most of the weight is still in that standing leg, but we're using the wall to give us a little bit of support, and we're pushing the hips back so that standing knee is staying stacked over the ankle. Let's go ahead and switch sides to place the other foot onto the floor, other foot's into the wall. Inhale to lower, exhale to come on up. So again, we're keeping the weight forward in the foot, not leaning back into the wall. And the foot on the wall does not have to be flat. You can be more on the toe if you need as well. Go ahead and place those weights down. Grab onto your long band for that half kneeling press with rotation. So outside knee is up. That band is going to come to the center of your chest. And we're going to rotate towards that front knee. So press that band out and then rotate to twist away and then come back in. Let's go ahead and switch directions. So facing in the other way now. Outside knee comes forward. Press that band out and then rotate away. As you rotate, think weight in the big toe of that front leg. This is going to help to increase that inner thigh activation to help with that kind of rotation and core activation even more. Go ahead and release that band, and let's come onto our back for 1 minute of the opposite knee press, alternating the legs. So think slight tuck underneath of the butt, and then lift the hips up off the floor. And then exhale, lift one leg as you press hard with the other hand, and then switch feet. If the hips elevated variation is too much, you can also keep the hips down on the floor to give yourself a little bit more support. But if you feel ready, lift the hips up just to kind of decrease the stability a little bit and make this a little bit more of a core challenge. More does not always equal better, though. So if you are choosing the harder variation just to choose the harder variation, but you're kind of wiggling and wobbling all over the place, we're not going to feel as much core activation because you're having a hard time stabilizing. So with this, we should feel this kind of diagonal activation through the core. Now let's move into round number 2, back to our box squats. So grabbing on to your band. Inhale to lower, exhale to come up, and we're keeping weight in the feet the entire time. Inhale to lower, exhale to row that band as you extend. Think inhale into like the bra strap line area to like the lower back, and then exhale, think lift up in that pelvic floor. And switch. Let's move on to that wall supported RDL. So again, the weight is primarily in the standing leg. If you want to use a yoga block, feel free. And we're using the wall just to give us a little bit of support. So inhale to lower down, exhale to come on up. So we're pushing the hips back towards the wall, but keeping weight in that front foot. So we're not sitting back into that heel. Think shoulders down and back, holding on to the weight. Let's switch feet. So other foot now down on the floor. Switch the other foot to the wall. And again, most of the weight's in the foot that's on the floor. Inhale, lower. Exhale, come on up. Think shoulders down and back, so we're engaging in the lats. We're not just sagging here with the weights. Hips are sitting back towards the wall, but weight is still in the front foot. Let's go ahead and place those weights down. Grab onto your long band for the half kneeling Pallof press. So outside leg, or the side we're rotating forward towards, is the front leg. Go ahead and bring that band to the center of your chest. Exhale, press out, weight in that big toe, and then twist. When we put weight in that big toe, this leg internally rotates inwards. And so we have this like counter rotation happening through the core. Let's switch directions. So outside leg is forward. And same thing, we're gonna think weight in that outside big toe. Press out, rotate away. So we're kind of like crunching to this outside. Go ahead and release that band. And now let's move onto the floor for the opposite knee press. Hips are going to either be down, which will be an easier variation to stabilize them, or they can be elevated. Neither is better. It's about which one you feel the best in. Which one do you have the most intensity that feels like you can stabilize? Exhale, press hand into opposite knee, and then switch. Before you switch feet, think put weight into the foot that's going to stabilize, and then switch. So I think put weight into my right leg, and then I'm going to press into my left, put weight into my left, and then press into my right. So what we don't want to do is as we're pressing, the hips are kind of falling all over the place. And if you feel like you're having a really hard time keeping the hips level, just lower the hips down to the floor. It's okay to choose the easier variation if you feel it more in your core. Let's go ahead and move into our final round, back to that box squat row. So grabbing on to your band, and we're gonna keep weight in the feet the entire time. So big inhale into the back to reach forward as you lower, exhale to row. Keep weight even through both feet. and switch. At the top, if we're having any lower back pain, think just like slight tuck underneath of the butt as you row. Sometimes when we row, we tend to get too archy with it, and it could put a lot of compression in that lower spine. Go ahead and release that band, and let's move on to the wall supported RDLs. So grabbing on to your 2 weights. If you want to put that yoga block between the knees, feel free. It just adds in a little bit inner thigh activation. And then opposite foot is into the wall. So most weight in that standing leg. Inhale to lower, exhale to come on up. So hips are moving towards the wall as torso comes towards the thighs. Knees staying stacked over the ankle. And then we're active with those weights, so we're not just sagging with them. And let's switch feet. So other foot comes down onto the floor, opposite foot into the wall. Foot doesn't have to be flat. You can be up on the toe. Inhale to lower, exhale, press up. The knees staying stacked over the ankle. Shoulders are active. Place the weight down, and let's move into that half kneeling Pallof press. So outside leg is forward, and the leg we're rotating towards is forward. So think weight is in that big toe side. Bring that band to the center of the chest. Exhale to press out and away. Weight in that big toe, so we have more of that connection happening here, right in the lower abs, and then coming back. Try not to curl in the toes, so we're keeping the foot flat. Let's go ahead and switch sides now. So outside knee is forward. The side we're rotating towards is forward. Weight in that big toe. Exhale, press out, and then rotate. Almost like we're crunching towards that side we're rotating towards. All right, let's come down to the floor for the opposite knee press to finish up this workout. So hips can be down or elevated. And we'll go over one more advancement in case you need a little bit more. So go ahead and elevate the hips. And then exhale to press into the opposite knee. If we want to advance, you can come up onto the toe of the support leg and then switch sides. So you're kind of pushing your hips up a little bit more by pressing into the toe. If it feels like too much, just stick with the other 2 variations. But now we're adding in a little bit more movement in the actual foot, which will be especially helpful when we're coming to do more like impact movement, running. Go ahead and lower the hips, and this concludes today's workout. If you enjoyed the workout, be sure to check out our online postpartum programs and our online prenatal programs if you're pregnant, because you can do this workout while you're pregnant as well. So in our online programs, we offer that in two main formats. We have our on-demand format, which is like this, full workout video that you follow with and work out with me at the same time. And option 2 is going to be our app-based program. And so this is going to be for somebody who likes to work out in a gym setting at their own pace. This is going to be a list of exercises with short demo videos to kind of help guide you through your pregnancy and in the postpartum. You can check out all of our fitness programs on our website at mamastefit.com/fitness-programs and use code YouTube10 to get 10% off, and we'll link them down below. And if you enjoy this workout, we release one new workout video every week, which is a follow-on workout that you can do. So be sure to subscribe to our channel so you get notified whenever we release this new video. And we release tons of educational content throughout the week about movements that you can do to support your pregnancy and your postpartum, educational content on like the medical side of pregnancy and birth and the postpartum, and then also our weekly podcast where we talk about different topics during pregnancy, birth, and postpartum, plus birth stories from followers like you.